something that is very troubling to me, that is affecting the Caribbean and Latin America, that we now screen of something you call congenital hypothyroidism. Congenital hypothyroidism, it's a program that, where I study, it's a program that is very active. They have a very proactive approach towards it. Every child is actually screened for hypothyroidism.
That was Guyana's prestigious endocrinologist, Dr. Caleb Mc Gloggan, during a recent interview with the Nightly News. Dr. Caleb shared the view that while some other countries have a robust screening program for congenital hypothyroidism, this is not so in Guyana. As an endocrinologist, Dr. Caleb is responsible for treating thyroid diseases such as congenital hyperthyroidism. So what is hyperthyroidism? Dr. Caleb explains.
The thyroid gland is a gland that produces something called the thyroid hormone. This hormone is necessary for the maturing, for the maturation of your brain cells. So what happens when you do have hyperthyroidism? You don't have the production of this hormone. So the brain cells, the brain doesn't develop, the central nervous system doesn't develop the way it's supposed to.
As a consequence of this, the child may have extreme brain abnormalities and neurological complications, Dr. Caleb said. However, this can be avoided if screening is done.
So what happens? Normally, if this child, if you can catch this early, let's say a week after birth, and we start treatment, all of that can be prevented. It's an approach that the World Organization is actually taking worldwide. They're trying to get most countries to do these programs to try to screen at birth for congenital hypothyroidism.
Dr. Caleb conveyed that he is ready to work with the Ministry of Health to ensure that this much-needed screening program becomes readily available in Guyana.
That is one thing that I think that I'm hoping that we can work with. Again, our minister is very open to suggestions. He just tell him what needs to be done, and he's always willing to assist in these aspects.
In 2019, an estimated 3,000 infants were screened for congenital hyperthyroidism at the Georgetown Public Hospital, the first newborn screening activity to be done in Guyana. According to the head of communications of the GPHC, Shalana Providence, screening of congenital hyperthyroidism is no longer being routinely done at the institution. For the HGP 90 News, Kendell Richmond.